We are so happy to welcome you to the brand new Nash Healthcare System Heart Center. CEO Larry Tuning is here, and Larry, this is the first time I've been in here. It's beautiful.
Isn't it spectacular? We're so pleased.
Well, and for us here in the area to have something this fine, the future is just really bright for all of us with the new pediatric emergency room, the new emergency room. You can serve so many people. Of course, having the pediatric part with under 17-year-olds separate to provide more comfort for the young people and their families. But the Heart Center, I knew that in 1989 you all started with heart catheterizations.
Correct.
And that was a big step then, but in 2011, tell us what you added on.
Well, really, in 2011, we made a definitive decision that we were going to build a true heart center, that we were going to combine all of our cardiovascular resources into one place. And is not unusual that as we grew through the years and added various both diagnostic and treatment protocols, those services were really spread out all over the campus. We had nuclear cardiology in one spot, and cardiac catheterization in another spot, and echocardiography somewhere else, and our cardiac ICU somewhere else. So, and in 2011, with the help of the physicians at the Boyce Willis Clinic and the folks at the East Carolina Heart Institute as well, we decided that we were going to make a major investment in cardiovascular care, and in essence put all of our eggs in one basket, build a heart center where it could be a full service treatment and testing area in one facility, where the patients didn't have to wander all over the campus, that they could have kind of one-stop shopping and get all of their cardiovascular care in one area. And
their families too, because when you have a patient, you've got family members running around behind them. But you mentioned the partnership, Boyce Willis and Vidant.
Correct.
Involved with this, and with the UNC partnership that we're all really excited about. Is that going to continue? Can you continue other partnerships also?
Yes. When we were pursuing our affiliation strategy that ended up with just a great choice with UNC as our partner, one of the things we talked about a lot was that we had some strong pre-existing relationships that we wanted to survive the relationship with UNC, and one of those was certainly our relationship with the East Carolina Heart Institute. Before we kind of took the next step and started doing the PCI program, which will eventually lead to our STEMI program, we really had to choose a tertiary partner, and when we made that decision in 2011, it was with the folks in Greenville, with the East Carolina Heart Institute, and they've been just a great partner in education and training and helping us choose equipment, and also really helping the design of this heart center. So it's been a true partnership, and obviously the very key ingredient is our cardiologists, who are just great.
And you've really attracted here in the Rocky Mount area a marvelous team, haven't you?
Yeah, we really are very, very, very blessed to have the talent that we have in a community hospital here.
Well, and going forward, I mean, when people come here, and I wish that nobody needed it, but truly in this area we're known for having a tremendous number of people who have cardiac issues, and to be able to be treated right here in our community, and then if something else like open heart surgery, then you would move them to another health center, correct?
Correct. And I think there are probably common misconceptions around, well, gee, you really can't be a true heart center if you don't do bypass surgery. Well, of every 200 patients that show up at the emergency room with some form of chest pain or some complaint of cardiovascular distress, maybe one of those needs bypass surgery. So
1 out of 200?
So, wow. So the other 199 need some less severe intervention that we feel like with the advent of this heart center and our partnerships, we can care for them right here.
In the emergency room, the new emergency room is right underneath this, right? So if one comes in through the emergency room, they can just be brought right up to the next level?
Yeah, really both both of those facility needs, both building projects really coincided. So we were fortunate that we were able to build a heart center right on top of the emergency room and in essence coordinate how patients move from one facility to the other. So that seems to have worked out pretty well.
Larry, people might not realize too that we are here in Rocky Mount at Nash Healthcare Systems, but you serve how many surrounding counties?
Well, we really draw from a 4-county area. I mean, we get when we do our planning analysis, we look at the populations in Nash, Edgecombe, Wilson, and Halifax counties because we draw so many patients from all of those areas. So it's not just Nash County by any means. So.
Mm-hmm. And I know you have shared statistics about the emergency room and how many people, and we're way under able to, what is it, like you built for 40 and you have 65,000 a year and
that's correct.
Only built to accommodate 40. Now you're going to have 85,000 capability. But
yeah, new capacity.
What about this? I think the real beauty that you pointed out is that all services for the heart are right here, so people won't have to be running all over campus. Do you feel like you are built for the future, so you've got expandable capacity here?
Yes, we do. We realize that our base of patients requiring cardiovascular care we expect to grow, and so when we
aging of the area.
Yeah, exactly. Yeah. You know, our health statistics in this area are not good, but clearly the baby boomer generation. Now, you're too young to be in that gene, but I'm a classic baby boomer, and as the population ages, then you know, the need for cardiovascular care goes up dramatically. Mm-hmm. So we, again, in designing this facility from a size and scope standpoint, we wanted to make sure that we had the capacity to grow beyond the number of patients that we're treating right now.
Well, as someone who loves this area and plans to spend the rest of my life here, I am absolutely delighted at the forethought of the board, of you, of the involvement with UNC in the future and whatnot, because I think we can all take great pleasure in knowing that this fabulous facility is here waiting for us. Should we hope we don't need it, but you know, the chances are that a lot of us will need it, our family members. And folks, it's beautiful, and you can drive right up to the front door or come in through the emergency room, and it's ready for you.
Absolutely.
Great. We're going to take a break, and we've got Sarah Heenan and also Dr. David Varmer going to join us. Thank you, Larry.
Thank you, Jean.
Are you just starting out on your own and want to be independent? Do you have a family and need a bigger home? Are the kids moving out? And are you downsizing? First Carolina Realty can help. A 1 or 2 bedroom apartment or house for those starting out. A 3 or 4 bedroom home for a growing family. Rentals, sales, new homes, pre-owned homes, investment property in the city or in the country. Call First Carolina Realty. Now is a good time to make that move. Real estate prices are right, interest rates are low, and there is a fantastic selection of homes available. First Carolina Realty is a full-service licensed real estate firm with offices located at 1100 West Thomas Street, open 9 to 5:30 Monday through Friday. If you have rental properties and are tired of the headaches associated with managing them yourself, or if you're looking for a new management team to manage your rental properties, call First Carolina Realty at 252-985-2321. Visit our webpage at firstcarolinarealty.com. We will gladly help you with all your real estate needs.
Hi, I'm Jean Almond of Almond's Drugs, and I want to invite you to be Almond's customer for your prescriptions. Our average pharmacy wait for your prescription is only 10 to 15 minutes. We have drive-through windows at both locations. We will deliver your prescription free. Our friendly and very experienced pharmacists specialize in consultation, and we are locally owned and have been a loyal part of your community for over 70 years. Just make one phone call to us and we'll make the transfer so we can start taking care of you. Welcome back. We are in the cath lab at the new Nash Healthcare System Heart Center, and of course Larry Tooney, CEO, is stayed with us, and we're happy about that. But Sarah Heenan, who is Executive Director of the Heart Center, I hear you're the Queen of Hearts. Is that right, Larry?
Absolutely, she is the Queen of Hearts.
Well, great. And Dr. David Varma, who many of you know, I hope you might know him as a patient, or you might know him from around town, because you've been here, Dr. Varma. You're the Medical Director of the Heart Center, but you've been in Rocky Mount since '89, right?
1989, yeah.
And the catheterizations that you've been doing, and this ought to give you guys a real comfort level, you've been doing actively catheterizations in this area since that time, since you came, right?
Yeah. Since 1989, we've been doing heart catheterizations, and I'd be hard pressed to say that we haven't done 500 cats per year for the last 25 years. So about 12,000 cats under our belt here.
Well, this room is one of two so far. You've got the capacity to add one more eventually if need be, Larry?
Yes, that's exactly right.
But it's magnificent. I bet you just feel like this is just, your dream come true, isn't it?
Well, as a young kid coming out of the University of Virginia back in 1989, I got to participate in the building of a nice heart center, Hardy's Heart Center, back in 1989, which is downstairs, and has served us well in the hospital well. But wow, this is just a culmination of a dream come true. I mean, Larry's and Sarah put together a heart center that rivals some of the best heart centers in the state, and gives us great equipment to work with, and with the physical proximity of all of the heart services located in one area. And that is going to be great for patients, their families, the physicians, all of the staff that work here. So it's just going to be a great advancement for what we have available in the area.
Sarah, put the caliber of this particular equipment into perspective. Isn't it just top of the line?
So this platform is the first platform to be installed in the United States. Nobody else has this platform.
Wow.
So this is GE's absolute latest platform. In fact, when GE came in, and they've been involved very early on in the planning of the cath lab, they said we have built the perfect cath lab, absolute perfect cath lab. But we are very proud of having the absolute latest technology.
Mm-hmm.
You can't go anywhere else and get this.
Well, and that should give people who are used to, before you're able to do what you are now with stents and everything, who always thought in terms of we have to leave the area. Now, this is a very viable place for them to stay and get the top of the line care, right, Dr. Varma?
Absolutely. I think that the ability to perform catheterizations here has been present for a long time. Mm-hmm. But as you say, many of our patients wanted to say have an angioplasty or a stent done at the same time. And the hospital, with its vision, really helped us launch that program with partnership from Greenville and Vidant and the Boyce West Clinic to allow us to do angioplasty and help build a program that is structured and well recognized, and a great quality program. Over the last few years, we've been able to do angioplasty in Rocky Mount. And that's really allowed the patients to be more satisfied and the families to be able to stay in town. Mm-hmm. And now with the improvement in physical structure and the proximity and the beautiful improvements in the new heart center that we have and the great equipment, I think that patients are going to be even more satisfied. And I think that Sarah and her team have done a great job in focusing on the patient satisfaction and making sure that the patient is an important part of the healthcare process and not just a number of, going through a mill of patients that are undergoing procedures. That's a very big focus of the program in Rocky Mount, and I think it's been a great adventure to be involved with, and this great journey to be involved with over the last 25 years, and I'm so glad to see it move forward. I mean, we're very thankful to the hospital and the hospital board to have the vision to build this, and I agree with you that the future is very bright. Mm-hmm. And holds a lot of promise.
So that needs to be underscored, the absolute commitment of this hospital and this hospital's corporate officers group and this hospital's board to this community. Mm-hmm. Because that's what this is. This building, not only the heart center, but the emergency department, is a commitment to this community. Mm-hmm. That we are going to take care of the healthcare needs of the people we serve. Mm-hmm. And that's what this building really represents.
And Larry, I believe the helipad now, if someone, once you do everything that can be done here, if it is determined that one needs to go elsewhere, that's even been moved closer, isn't it?
Correct. That's exactly right. It is directly adjacent to the emergency room. Right now, today, if someone will transport it either in or out, there is a short ambulance ride between the helipad and the emergency room or wherever that particular patient is going. But right when the new emergency room, the new heart center open up, the helipad is right outside, so it's a very short stretcher ride to the helicopter. And air ambulance transportation is becoming more and more prevalent. So designing adjacency of that was important for us.
To this whole center, it's right there. Well, while we're in the cath lab, Dr. Varma, how about showing us, for those who might not know what a catheterization is, show us what it entails.
Sure. Well, I've got a model of a heart right here sitting in front of us. And if you think about the heart as a house, it's pretty easy to understand. You've got 4 rooms to a house, or some rooms have four rooms, and some houses have 4 rooms. And so this is the pumping chamber of the heart, called the left ventricle. This is the right ventricle, the right atrium, and the left atrium. So these are the 4 rooms to the house. And if we close the heart back up, just like any house, there's plumbing or water supply coming to the house. And to the heart rooms and to the muscle that's located in the heart, there are blood vessels, these coronary arteries that take blood to the heart muscle. And so these coronary arteries are what take oxygen and nutrients to the heart muscle and keep the heart muscle pumping. And the heart muscle doesn't get a break. It's working every minute, 60 times a minute, 70 times a minute. It's not like your arm muscle where you can say, oh, I'm tired, I'm going to relax. So with the heart catheterization, the purpose of the catheterization is to take pictures of these blood vessels. And so the way that we do that is we will actually insert a catheter, which I've got sitting on this table.
And that's a real one that you would use.
That's a real catheter. Of course, our catheter that we would use would be sterile.
Right.
So it would be out of a packet and it would be on a table. And so we would insert this end of the catheter inside the body, and this end would be outside. And so this catheter is then sitting in the opening of the blood vessel. And we're injecting dye through this catheter here, and then it comes and fills this blood vessel. So the whole purpose of the catheterization is to allow contrast to be injected into the coronary arteries so we can visualize it. If I took a picture of your heart right now from the outside, we'd see your heart, but we wouldn't see the blood vessels. But if I have this catheter outside and I'm injecting dye and it's coming out the other end, then it fills the blood vessel. Now, it's like a Nintendo game, except that the blood vessels in the catheters are pretty small. These blood vessels are about 3 millimeters, and we've got to get the catheter from your wrist or from your groin back up to the heart, and then find the opening to this blood vessel and then inject dye through it. So that's what allows us to see what the blood vessels look like.
And a person doesn't need to be put to sleep for that either.
No, we have the person sedated and we have the person comfortable, but we don't have to knock the person out. If there is a blockage that's present, if you can hand me that, Jean.
Okay.
Sometimes we'll end up putting a stent inside the coronary artery. And so here's a picture of a stent that's inside the glass. I'm not sure how well it projects. But basically, it's like the spring of a pen. And that is inserted into the blood vessel. And you can see how small these blood vessels are. They're 3 millimeters. And so that stent has to fit inside the blood vessel without overexpanding it. And so that's what keeps the blockage from coming back or collapsing. So the idea is through this catheter to deliver this stent in the middle of that artery where the blockage is present. And we have some excellent physicians doing that. In addition, we have larger stents. And you can see the mesh of a stent may be a little bit clearer on this, where these stents are made out of a wire mesh and they can keep the artery open.
And Sarah, what's the significance of the screen behind y'all?
So this is a screen that actually can show 6 displays. So if they're working on a case and want to see a previous case, then they can pull it up. If they want to see the echo, another test, they can pull that up. So they can see all the patient information at the same time while they're actually working on it.
And so this is like the TV screen when we're playing the video game. So we're standing here and we're putting the catheter in, and this here is taking a picture of what's going on in the body. So we're not advancing it blindly. We actually are advancing the catheter under X-ray guidance using this and watching the image on this TV here. And so by knowing exactly where the catheter is, so we can move it left or right or put forward or backwards and put it where we need to in order to get the best pictures and in order to get the blockage fixed.
And Dr. Varma, I really like knowing you've been doing it since 1989, so you have been practicing this on other people, 500 a year at Nash for 25 years. So that ought to give y'all great confidence of the talent and the
No, we have
experience.
some excellent physicians in our group, and we're all very experienced. I think more important than being excellent technicians and being experienced are that our physicians are excellent people. They care about the community, they care about the patients and their families, and I think that you're going to find that the care that you get from the physicians in Rocky Mount is just top notch.
Great.
So we're very, very happy with the kind of people that we've been able to recruit to the community.
We have moved upstairs in the new Heart Center to the second floor. And Sarah, tell us about this room.
This is a room in the cardiovascular intensive care unit. This unit is designed to take care of patients presenting with significant cardiac disease. So everything that a cardiac patient would need is in this area. So there's 8 beds. We are directly above the Diagnostic Center for Cardiac Services. So
Where we were a minute
right,
ago.
where we were a minute ago. So any kind of cardiac testing you would need is right below you. You would probably present to the emergency department, and so you would come right from the emergency department up here. Any kind of testing you would need is immediately on the floor below you. These rooms are also designed to be very family-centered, so if your family wants to come and stay with you 24 hours a day, they can. There's a bed right here. We have everything the family would need to be comfortable in taking care of their loved one.
Dr. Farmer, this is just, again, a first-class facility, isn't it?
It really is. I mean, the rooms are designed for patient comfort, but more importantly, for having up-to-date medical equipment for us to take care of the patients, and all the gases and all the equipment that's available for our use is available right in the room. The rooms are large enough so if there's a cardiac emergency in the room, that emergency could be handled in the room. Some of the diagnostic tests that we do at bedside can be easily done in this room compared to taking them out of their room when they're sick. So that those facilities allow us to really take good care of our patients here.
Larry, when I walked in, my first thought was, wow, this is huge. I mean, this is probably the biggest room I've
Patient
seen
room in the hospital.
in a
Yeah,
hospital.
they are.
And 8 of them, what was why 8?
We currently have our intensive care unit capabilities divided up into 2 components, and so kind of our overflow area as it exists right now has 8 beds. So we basically are picking up that area, moving it to the Heart Center, and designating it all for cardiovascular care, where right now there might be a post-surgical patient up there or a stroke patient up there, or several different diagnoses. But again, the intent here is that the patients that are going to be in these beds are specifically patients that have presented and been admitted with some type of significant acute cardiovascular issues going on.
And Sarah, the support staff, I know the cardiologist will be the medical staff, and certainly
Right.
Dr. Farmer is medical director, but all of the support staff will be specially trained.
Right. So we have actually started about 6 months ago with training with the staff. We train on a weekly basis. The nurses in this unit will also cross-train at Vidant. So they'll go to the CVICU at Vidant for a period of time for training. That's what we did when we started PCI too. That's one of the things that Vidant provides for us is staff training. So lots and lots of training. This program, we began training in this program probably in 2009. That's when we started training for PCI. Did our first PCI at the end of 2010 and been continuously training staff since then.
And a patient that's having a myocardial infarction or a heart attack and is sick, their family also needs a comfortable place that can be quiet. And that's one of the nice things about the unit is all the rooms are private. There's a nurse at the bedside who's able to watch right from the window. The rooms themselves are aesthetically nice. There's a room for the patient's family to stay. So it really provides an environment where healing can really occur, and in a setting where acute emergency can be tended to immediately.
And even the doors, I mean, they are secure from soundproofing. I mean, you can look through, but it
Right.
does give the privacy.
So we can look through the door, we can also look through the window. The nurse will be stationed right outside that window so she has direct vision line to the patient, but also designed to be quiet because there is a therapeutic milieu that we need to create here with cardiac patients.
And so people then would transition once they improve then to a normal hospital bed.
That's right. And all the computer ability of the patient within the room allows the nurse to know the patient's medications right at the bedside, so there's no mistakes or errors. And I think it's just the way to take care of patients in the 21st century.
And it opens when, Larry?
We will open March the 24th is the current plan, which is just a few days after the new emergency room opens up, which opens up at 3 o'clock in the morning on March the 19th. So that we'll get that up and running, and then transition into the new Heart Center, and hope that we will do our first cath probably within a day or two after we actually move into here. So
We're excited. Looking forward to
Well,
it.
and I think we're excited as a community too. I don't think I just feel like we are so blessed and so fortunate to have this state-of-the-art facility. I mean, the first in the nation. One piece of equipment that you've got, or I guess you have one in each of the cath labs, but this is outstanding. And again, thank you on behalf of the community for the vision and the hard work that you all have put into this, because you're going to save lives here on a regular basis. So thank you so much.
You're welcome.
And thank you for joining us. We'll see you next week.